Is it a good idea to be working at a healthcare agency while in school?
Is it?
For real world answers to all of your questions on nursing, school, and life as Dr. Wife.
So there are pros and cons to this.
Okay.
If you are working in a healthcare environment in a hospital or a clinic, it can really help you with those first beginning nursing courses, because in the beginning courses, you're learning how to talk to patients, you're learning some basic nursing skills. If you're working as a tech or an aide, let's say in a hospital, then you may be checking blood pressures, getting vital signs, checking blood sugars, getting eyes and O's on your patients. Those are skills that you learn in your beginning nursing courses. And from what I've noticed, students who work in a hospital find that part of those courses much easier than students who have never talked to a patient, who have never taken a blood pressure. For those students, they have a lot of confidence going into those beginning nursing courses. So that is a great advantage of working in a healthcare agency, especially at the beginning of nursing school. Probably a disadvantage, though, is that as you progress through the program, you may find that you're exposed to a lot of practical nursing care and practical things on the job that may or may not be evidence-based. And so as you progress through the program and you're learning the theory behind why nurses do what they do and the evidence behind nursing care, you may see some disparity there between what you're seeing at work and what you're learning in your textbook. And of course that shouldn't be there. It should be the same, but you'll start to pick up on that. And I've had students who, as they're taking their later nursing classes, they would miss exam questions because they would say, well, in real life, we would never do that. We would do this thing. And so they had a hard time separating what was fact and evidence-based from what was practical or anecdotal information that they saw on the floor. And then, of course, the other, I would say, disadvantage, it's possibly an advantage, but could be a disadvantage too, is the environment that you're working in. So if you're working with nurses that are unhappy with their job, or they're exhibiting some behaviors and attitudes that are, discouraging to you, or they're, I don't even want to say divisive, but maybe nurses.
That whole nurses eat their young, that's just a saying, right?
Yeah, so you might be working with nurses that are not a lot of fun to be around, that may not be happy with themselves or their lives, and they bleed out onto the relationships they have at work. And so you can be mentored in a negative way. So you can have negative role models that aren't benefiting you. We're looking at more ducks.
Good role models.
Yeah, good role models, exactly. So if you have nurses that you're working with that are caring and competent and compassionate, they can be great role models for you. But if you're working with nurses that are tired, they're experiencing compassion fatigue, they're unhappy with their job, their life, patient care, they don't like patients anymore, then that can be a negative role model. So I think that's just something to think about. The other thing is that as a nurse's aide or a nurse's tech, you're doing a lot of basic nursing things, but you're missing the awesome parts of nursing. And so some students have said that just taking people to the bathroom and answering call lights really discouraged them from wanting to continue in nursing, because they thought, I don't want to do this for a living. And so just remembering the role of a nurse is a lot more than that. Getting good at those things is good, but the role of a nurse and the profession of nursing, it goes way beyond some of those basic things, and not letting that discourage you if you're seeing that in your job at a healthcare agency.
Wow, you're so eloquent.
That felt about as least eloquent as possible as you're leading me into the grass and back again.
I'm not saying my guidance skills are eloquent. I'm simply referring to your ability to speak with great clarity and thoroughness.
Oh, thank you.
In spite of running across an adorable little family of ducks and the Parthenon. There are so many great views at this place.
It's gorgeous.
What a great way to spend an afternoon.
Nursing school won't feel so tough. Helping others won't be so rough. You are confident, compassionate, and so much more. But sometimes it feels like you're not too sure. So when